Many people I see in clinical practice were diagnosed with GERD and prescribed an acid-blocking medication, sometimes for years. But many of them still have symptoms despite the medication, or they have concerns about long-term use of that medication, and they'd like to be able to discontinue it, but every time they try, their symptoms come right back. So today, I want to talk about GERD from a functional medicine perspective and explain how GERD isn't always about acid. If you've been told you have acid reflux, then this video is for you. So GERD stands for gastroesophageal reflux disease, and it has common symptoms such as heartburn, chest discomfort, regurgitation, nausea, chronic throat clearing, or maybe even a chronic cough. But one really important distinction is that GERD actually has two forms: erosive versus non-erosive GERD. So in erosive GERD, we actually see evidence of inflammation and erosive disease on endoscopy. Whereas non-erosive GERD, the endoscopy is normal. There's no significant inflammation or erosive disease present. We call this non-erosive type NERD for short, non-erosive esophageal reflux disease. Most people with GERD actually have NERD. In fact, 70% or more do not have evidence of erosions or inflammation on endoscopy. And non-erosive GERD is less responsive to acid-blocking medications. So non-erosive reflux disease lends itself beautifully to the functional medicine approach. Because non-erosive GERD is typically not an issue with inflammation or damage from acid, it's typically a functional disorder, meaning there's probably something upstream, an imbalance leading to poor digestion, altered motility, impaired mucosal lining, or something besides just acid causing the issue. In conventional medicine, we think of GERD as an issue of too much acid. That's why the common treatment is an acid-blocking medication. Common medications used in GERD are things like ranitidine, omeprazole, and pantoprazole. And these medications absolutely have a role, especially in erosive disease. On endoscopy, if a patient has moderate to severe esophagitis, Barrett's esophagus, or peptic or duodenal ulcers, acid-blocking medications are an important part of the treatment plan. So this isn't about demonizing medications, but what it is about is for those people with non-erosive disease, stepping back and asking the upstream question, are there other things contributing to my symptoms that I can address so that I'm less dependent or not dependent at all on medications? So in functional medicine, we step back, we zoom out, and we ask what upstream imbalances are contributing to the downstream symptoms. In non-erosive GERD, we think of things like impaired esophageal or gastric motility, increased abdominal pressure or hiatal hernias, inaccurate relaxation of the lower esophageal sphincter, reduced saliva or poor mucosal defenses, gut-brain axis dysregulation, chronic stress and nervous system imbalances, and alterations in digestion, absorption, or the microbiome. So for many people, acid isn't the primary issue. It's the timing, movement, and coordination of the digestive system. And simply blocking acid will not solve the root problem. Now, lowering acid through medications may improve symptoms, at least temporarily, but reducing acid doesn't correct motility problems. It doesn't address sphincter pressure or coordination. It doesn't address stress or nervous system dysregulation. And it certainly doesn't address digestion, absorption, or the microbiome. And long-term use of any medication can have unintended or downstream consequences. So the decision to treat with medications needs to be weighed very carefully. If you're dealing with chronic reflux, it doesn't mean that your body is broken. It usually means that something upstream needs support. So in this series, we're going to break down how is GERD properly evaluated, when medications are absolutely helpful, and when they may not be necessary, potential risks of long-term acid-blocking medication use, when weaning off medications might be appropriate, and most importantly, how to approach GERD from a functional medicine perspective to support long-term healing. My goal is to bring you clarity so that you can make decisions based on understanding and not on fear. If this series sounds helpful, I'd love for you to follow along. And if there are any specific reflux topics you'd like me to address, leave a comment below. I read every single one. I'm Dr. Kate. Thanks for being here.